Hi, I'm Zach. If you've been suffering from heel pain or Achilles tendonitis for years, this episode's for you. We're going to show you today how to fix Achilles heel pain, not by fixing the calf or the Achilles, but by fixing the hips. But before we do that, we're going to show you an athlete that suffered from Achilles heel pain and did our testing and protocol and was able to get back into running and jumping again. Achilles tendonitis for how long?
About a month and a half now, getting worse.
About a month and a half. And now, so his goal is to get to 10 pounds. And once he gets to 10 pounds, that's where we're going to see the Achilles tendonitis go away. Doing any sorts of inversion, it was extremely weak. But when he went this way, and this is the side where the Achilles tendonitis is, when he went this way, he's really strong here. And most athletes, they get injured at the strength, not the weakness. Alright, so any pain?
No. No pain.
Alright, so the reason why this athlete developed Achilles pain or heel pain is because of a weakness in the groin and a weakness in the post-tibialis. And the reason why a weakness in the groin would cause heel pain or Achilles tendonitis is very simple. The body goes, you know what, I don't have this strength through the groin, so I'm going to put a little bit more pressure down in the soleus and down in the Achilles. That's ultimately what leads to Achilles tendonitis or heel pain. So what I'm going to do today is I'm going to show you how to test the groin, and then I'm also going to show you a little bit different variation on how to test the post-tibialis. So in episode 3, we went extensively over how to test both the post-tibialis and the peroneus. So you can go back and review that episode for more information on how to test those. But I'm just going to show you a little bit different variation today on the post-tibialis when you're dealing with Achilles tendonitis. So in the other episode, I showed you when you're coming up to pull the toes back. Don't pull the toes back on this because it's going to put more pressure on the heel because there's a muscle that runs right up into the heel here. So when you do that, that's going to put a lot of torque back on the heel. So you want to just keep the toes neutral when you lift up and down. And another thing you can do is, besides using, I showed dumbbells, you can also just take an ankle weight, roll it over, and you can just come up and down like that. So just go and review episode 3 for that testing, and you can apply that to someone that has an Achilles injury. But today what we're going to do is we're going to address how to test the groin. All right, so very simple. I'm showing you here 2.5 pounds. Okay, 5. This is 2.5 and 5 is going to be more on the weaker range here. 7.5 to 10 is going to be on the stronger range. This is what we want to work the athletes up to. This is how you know they don't have a weakness. So here's how the exercise works for testing the Magnus. Okay, what we're going to do is we're going to lay on our side just like this. This should be light. Okay, you don't want to post over here. You want to kind of stay a little bit open chain here. So you want to stay open chain here. You're going to notice too that my foot is turned down. You don't want to be doing this because this is going to get more into the top of the adductors, into the hip flexor. Okay, so what we're trying to do is we're trying to concentrate here on testing the Magnus. The athlete should only feel it in the Magnus area here. So when you lift up, just like this, we're going to do 15 reps to test. And what I'm looking for here is you're going to see athletes are going to want to do this. That's how you know they're weak. And also, if they do this and they feel it more up into the hip flexor chain here, and not into the Magnus, then you know there's a weakness. And also, if they feel it into their glute medius back here, they'll do this exercise, and when they're doing it, they'll feel it in their glute medius. That's how you know immediately, look, the groin magnus is weak. So what it's doing is it's recruiting more of the medius because both the adductors and the medius work together to medially rotate the leg. So they're interconnected, and that's why if there's a weakness in the Magnus, what it's going to do is it's going to go, you know what, I'm going to recruit more of the glute medius in order to do this exercise. So again, I'm just laying here, and I'm coming up and down. And over time, if you see that there's a weakness, even with 2.5 pounds, I'm going to show you different variation that you can use in order to recruit the groin magnus, and then go back to these weights here in order to effectively activate it. So if the athlete fails that test and he doesn't feel it in his groin magnus, he feels it more into the hip flexor or also into the glute minimus medius area, then there's two things that you have to consider. First is, in the prior episodes we talked a lot about how to test the glute minimus and the importance of it. Well, if the glute minimus isn't working efficiently, the adductor chain doesn't work as efficiently. So by strengthening up the minimus will also help to activate and get the groin functioning correctly with the rest of the hip muscles. Secondly is, this is what we do. If the athlete does not feel it in the magnus from that test, this is the best way to do it. Is you can get towels, or these are just some pads here for some cushion. But what we're going to do is we're going to put our legs very low here, and we're just going to squeeze. And the athlete's going to feel it right into the groin area. There's no way out of that. If you put the legs up too far into hip flexion, when you do this, if the athlete has a weakness in the groin or in the minimus, it's going to go, even though they're in adduction here, it's going to go right into the TFL. So you got to make sure that you keep the legs low and then you just squeeze. So then what I do is I get the glute minimus strong using the testing method in some of the prior episodes, and then I also do this exercise here for 2 weeks and get this functioning properly. And then I go back in and I start strengthening up just like the test exercise that I demonstrated initially. If you enjoyed watching this video, please subscribe to our channel and like this video. For more information on how we rehab and train athletes, visit our playlist titled Educational Episodes.